Periacetabular osteotomy, also known as PAO, is the surgery that we most do for hip dysplasia. Taking a dysplastic socket and making cuts around it, like this, and then taking the socket and reorienting it so that when you're done, the socket actually covers the ball better, like that, okay? And the surgery is done through an incision in the front. We can get to all this from the front. We do it under, some of it's under very strict x-ray control, and it takes about 2 hours, 2 hours and 15 minutes usually, somewhere in there. Essentially, you're cutting the bone, rotating it, so it's like you're making a controlled fracture around the socket and then securing it with screws. We have to do significant pain management for it. One way that I like to do is to put in an epidural catheter, like when a woman has a child, and leave it in for 2 days. When the patient wakes up and first mobilizes, we have really good pain control, okay? Then after that, we also use periarticular injections, which we learned in the total joint replacement world. And then we also use preemptive analgesia that we learned in the total joint replacement world, meaning use a number of different minor pain medications to treat pain, so we don't have to use opioids so much. A patient isn't put in a body cast. The screws hold everything in position, but they can't put weight on their leg until the osteotomy, the cuts, start to heal well enough and fill in with bone so that the pelvis transmits its force through to the socket and doesn't move the fragment that we've rotated. So in periacetabular osteotomy, we sort of feel that if we can buy a decade of natural hip function in a teenager or someone in their 20s or 30s, that's a success, or it's worth doing. We don't aim for that, we aim for much better than that. And again, there's some patients who are probably good for life with a PAO if you catch them before they're arthritic. What are the long-term benefits of PAO? Well, number one would be returning to activities that you weren't able to do. So some of it is the immediate benefit. Some of it is getting rid of pain, all right? And that's, once you get through the surgery and the recovery, pain is generally, people can get back to having a hip that feels pretty normal. Long term is what you really think about, and we like to think that if someone gets 10 years of very good pain-free hip function, that it's worth doing, and we aim for a lifetime, and they possibly will get a lifetime out of it.